Hi everybody, this is a video talking about the language barrier that deaf and hard of hearing people face, American Sign Language, and kind of what I've seen and what I've done research on of the problems that deaf and hard of hearing people have in the medical field. So the first thing for deaf people is that a lot of doctors don't acknowledge or understand that there's a deaf culture and there's a bunch of different parts about them. And they look at it as not something to be proud of, as most people that are deaf and hard of hearing are. They're proud of who they are, they identify themselves as deaf, hard of hearing, use American Sign Language, etc., and they're proud of it. But doctors kind of look at it as something that needs to be cured, which is why kind of like the cochlear implants controversy comes up sometimes. They think, it's a medical condition, and it's not something that is. Life has definitely been improved now, of course. More physicians are more open, but there's still a kind of struggle. And this goes into the language barrier. They don't know that American Sign Language sometimes is not counted as a language. It's definitely now, but a couple years ago and even more, it wasn't really counted as a foreign language or a known language. But it is now, and it's something that needs to be regulated and something that should be really given an option for every child to learn, every adult to learn, and every medical professional to learn as other different languages, that there should be a basic, so you can have your patients feel more comfortable until, again, we get into that interpreter stage. So doctors feel uncomfortable, and they don't know how to act because this person can't hear me. I don't know how to act. Can I be normal? They talk louder. Talking louder is not going to do anything to someone who is deaf. They can't hear it at all. So most people can understand if you're talking louder, and it's rude. So you don't want to do that. You don't want to feel uncomfortable. You don't want to create that language barrier, which is going to talk about in another video of more interpreting and the problems with that. And you don't want to look at them as something that needs to be cured. You want to look at the reason why they're here, for a broken leg, for cancer, etc. You want to look at that reason, not the reason of their death, which I feel like is a problem sometimes. And I've had friends, and I've done research that is a problem, is that they look at them being deaf and not the other issues the reason that they came in the doctor's office. And again, they just feel uncomfortable with deaf patients, so which creates a bad patient-physician relationship. The patients feel not heard, they feel uncomfortable. The doctors feel uncomfortable. They may not get the best quality of care because there's no language, there's no communication, there's no interpretation, there's no even ASL, and stuff like that is just rude. A lot of people that are deaf and hard of hearing, the doctors turn away and talk, and it's rude. You can't hear what I'm saying. You can't see my lips moving. It's hard, and that's rude. And that's something else that makes deaf and hard of hearing people feel uncomfortable. Myself, as a hard of hearing person, I can't hear you that well if I don't see your lips. Me reading your lips helps me a lot. So as a doctor, I've seen doctors who go behind the computer, and sometimes I don't know what they're saying, or I feel like, hello, I kind of need to know. So it's really good if you kind of are facing the patient and you're looking at their face so they can see your lips, they can see your facial expressions, or what have you for deaf and hard of hearing people. Again, not every hard of hearing person uses ASL. There's different levels. There's different even levels of being deaf. Deaf and hard of hearing has so many different levels, so many different communications, and I feel that sometimes in the medical professional world, we don't understand that, and there's that uncomfortableness. They think of it as a medical condition. They don't think of it as a culture, as something proud to be. So I just kind of wanted to give a broad over. I'm not going to get so specific into this until some people ask me about it, because there's so many different little things. I've done webinars and talks about this, about more specific issues, but this is just broad so you can understand the importance of understanding of why you need to know basic ASL, why you need to understand deaf community, and why you need to understand that there's an interpreter, is to help better yourself as a physician, help make sure your patient is comfortable in getting the best quality of care, also knowing that we're people, and it's not something to be frowned upon, it's not something to be scared of. It's just like any other person. We're just different, we're proud of who we are, but it's not like this huge disability that lacks everyday life. We can do normal. People are anything they want to be if they're deaf or hard of hearing. We're not just these bad people. And we're not bad people, but people that they just don't really look at. And so now people are getting more accepting of different types of people, but before, and there's still a little bit of struggle with the deaf community. So people saying, well, this community is more advanced and more accepted. Why is not the deaf community when these people are here in America and there's so many of them? So that's just something to keep in mind as your way of becoming a better physician and being more open and being more understanding of deaf and hard of hearing people. So when you come across them in your journey, especially if you're in areas where there's a big population, you're going to thank yourselves and you're going to meet some new friends and become a better doctor.